of Press NYC, we came together as New York City public school parents to advocate for a safe return to school. And that includes all of the mitigation factors and the non-pharmacological interventions that have been advised by scientists, physicians, epidemiologists, and parents across the country that are concerned for the safety of their children as we are still living in a pandemic. Today, you'll hear from parents, from physicians, from teachers, and from a student about what their experience has been like going to schools during the pandemic and what we know, because there's evidence out there that we need in our public schools in order to keep our children safe. We're going to start with Dr. Brenna O'Brien. She is the organizer of the Chicago Public Schools Sick Out, and she'll discuss the recent passing of two parents from COVID, parents of the Chicago public school system. Brenna, take it away.
Thank you. So my name is Brenna O'Brien, and I'm the mother of two children in the Chicago public school system. And I'm a parent organizer with CPS Sick Out. And we have been on protest for the entire time. We've been protesting since August 30th. We've been keeping our children home. It's been almost a month. And we really have been urging the district to just step up its safety mitigations, and we're strongly advocating for a remote option for families that are not ready to send their children back into the building. So Chicago Public Schools has been open for 1 month, and in that time, they've seen 1,443 positive cases, and there are 15,000 students in quarantine right now. This week, 2 mothers from Jensen Elementary died from COVID complications after their children were exposed at school. There were 11 out of 17 classrooms in quarantine at Jensen Elementary, and still the district did not close that school down, did not do deep cleaning, didn't offer remote learning to the whole school. So how many more lives need to be lost before the district does the right thing and puts the necessary safeguards in place to protect the children, families, and school staff from the spread of Delta? We know that Delta is spread much more easily than the original strain, and they just have not changed their plan since last year. We need them to make some changes right now. And so we truly hope that there will be some new changes under the new leadership of CPS CEO, Pedro Martinez. So we hope that Pedro Martinez will immediately come to an agreement with the Chicago Teachers Union and put in place the requested safety mitigations, weekly COVID testing, accurate contact tracing. CPS is currently only testing 3% of students. So that is not enough to find evidence of school spread. 3% of students, you're not going to catch what you're looking for. So we absolutely need much, much more COVID testing weekly in the schools. And so also we really hope, again, that Pedro Martinez will actually follow through on his statement that he said yesterday. He's looking into expanding remote learning to the parents and the students who are not yet ready to go in, who are anxious about the spread of COVID. And also, if a student tests positive, right now, the policy is that their sibling still goes to school. We need that to change. Any family member that has had a close contact, they need to be able to quarantine, and they need to be able to access remote learning. So we really do look forward to returning to learning in person once these changes have been put in place. So thank you, and we hope that Pedro Martinez pays attention to parent voices.
Kaliris, unmute, please.
Good point. Thank you. Thank you, Brenna. Here in New York City, we have over 3,000 COVID cases since school started in September 13th. And we have about 2,200 students that have been in quarantine, not to mention staff members. So we echo those concerns, and those are definitely some of the demands that we are asking for. But I'm going to pass it off to Taj Sutton. She's a fellow collaborator, organizer, activist here in New York City. She's a program manager for Teens Take Charge, And she's also part of the steering committee for Parents for Responsive, Equitable, Safe Schools. She was the one that organized and orchestrated New York City strike for safe schools. And she's going to really talk about what the inequities that have existed in the system, both in the school system and in the health system, that have impacted our communities, our Black and Latino communities that make up the majority of the New York City public school students. Taj.
Thank you so much, Khalidis, for that beautiful introduction. Thank you and welcome to everyone in the space. Thank you for being here. It's been a really, really rough 18 months. And so we're deeply appreciative of everyone who's continuing to make the time virtually to engage in these conversations. In New York City, we have been on strike since September 13th, which was the first day that our public schools opened. And it has been deeply troubling. In addition to the really important health measures that are not in place, which Brenna already mentioned, we are also dealing with the threats being made to our families as a result of participating in this strike. And what I'm seeing virtually is that this is the case in many parts of the country, including Chicago, that children's services are being weaponized against families who have valid health and safety concerns for their children. And there are health officials, and there are education officials, and there are elected officials who, unfortunately, instead of doing their jobs and protecting public health, are really concerned about reopening our cities so that they can boost our economies at the expense of our families, children, and communities' lives. So I'm so happy to be here today, standing in solidarity across countries to have an honest conversation about what is missing and what is being lost. I'd also like to uplift this deeply troubling narrative of learning loss that I think is being peddled in all of our communities to suggest that children need to be in school more than they need to be safe, or more than they need resources, or more than they need to feel secure and have the trauma of the last 18 months really spoken about and to have their needs supported in that regard. And I think it's so important that we understand that academic recovery is always an option, but we cannot bring our babies and our educators and our healthcare workers back from death. We cannot teach and learn adequately if we are sick and suffering and being unsupported and gaslit. And I think that that is something that is being experienced across the country. So I'm really happy to see so many different regions represented and saying with one voice, enough is enough. We are seeing the very similar gaslighting tactics and this weaponization of family services against families, suggesting that it's us, the parents, who are being neglectful of our children, or it's our educators and healthcare workers who are telling the truth, who are being neglectful, when really it's these systems in place that include individuals who are representing the interests of the dollar and not families and communities. And what we have to understand about school is that everything happening in the community is also happening in the school. So this idea that there is no in-school spread is really a farce that needs to be denounced in each and every one of our communities. We know that our babies are getting sick. We know that the Delta variant is that much more contagious. We know that there is still no vaccination for our children under 12, and all of our leaders should be taking that into consideration. What we could have in place is not adequate. I heard there's 3% testing in one region. I know for us, the max is 10% testing in New York City, which is abysmal and insufficient. And we also no longer have mandated testing in New York City. And so what's happening is hundreds of thousands of families are not submitting those consent forms. And so their children are unable to get tested because they don't have the permission. So even the small subset of individuals that we are testing is not sufficient to track and monitor in-school spread. Couple that with our really, really terrible quarantine protocols, if you can even call it that. And we're really in a place where we're seeing the results of terrible health practices, which resulted in the over 3,000 cases that Khalidis mentioned. There's so many great people here that I want to hear from. So I'll just close in saying that to our families who are striking, to our families who just found out, that you have this option today, we stand with you, we support you. There's an abundance of information, both data and science and anecdotal, that really confirms and affirms that you are doing the right thing for your families and your communities at large. And so we want you to keep fighting, to keep striking, to combat that learning loss narrative, to combat this idea that we are harming our children when it's really these systems that are harming our children. And we're harming many of our babies before the pandemic, which is why the disproportionate impact of sickness and death for COVID is impacting our Southeast Asian, our Indigenous, our Black and Latino comrades more than any other communities, and also our working class and immigrant comrades. If we had the healthcare and the public education infrastructure and the social services in place that could really support communities, right? COVID would not have ripped through very specific marginalized communities the way that it did, right? And so we need our leaders to address this. We need them to admit this. We need them to have honest conversations. And until they're prepared to do that, we are prepared to keep each other safe and our community safe by striking not just October 1st, but however long it takes to get the proper mitigation measures in place and to keep our communities safe. So I thank you all for what you're doing in your respective communities, and I encourage you to keep going.
Thank you, Taj. You're always such an inspiration to all of us. So we're here in community, we're here with each other, we're here to support each other. And what's important is that we continue to elevate the voices of individuals that don't have this access, that don't have these resources. Even though New York City is testing 10% of the school populations, we're literally just catching 5% of the cases. So not having testing in schools actually makes us even more vulnerable. And now we've changed the guidelines. Even unvaccinated kids don't have to quarantine if they have been exposed to a case. And so things are getting much more complicated, and we need to continue our advocacy and our education around understanding COVID, understanding the vaccines, the efficacy of vaccines, but we also need to highlight and uplift that a lot of our communities are suffering from medical mistrust. And so we still have to engage in culturally responsive conversations and supporting our communities so that they can make the best decisions, the most informed decisions for their families. But in order to do that, we also have to provide the children with quality education, and that may look differently for different communities. I want to introduce Maya Chavez. She's an educator in Providence, Rhode Island, but she's also the co-founder and CEO of HCW Hosted. It's a nonprofit that's been dedicated in doing all of this community work, right? To support not just educators, but healthcare workers and their families in understanding the pandemic and how we move forward from where we are. So Maya, please.
I think maybe we have mixed up two different speakers because you included some info about someone else in describing me. So I think someone else, and then I'm after that person. Sorry about that.
No, you can go first and then I'll figure out who this was. Thank you.
So I'm Maya Chavez. I'm not the founder of that organization. That sounds amazing, but kudos to whoever is the founder of that. So I'm a teacher in Providence, Rhode Island. I'm a high school social studies teacher, and this would have been my 8th year teaching in Providence public schools. So I want to talk a little bit about what my experience has been from a local perspective, and then kind of tie into some of these broader issues. So of the 24,000 students that we serve in Providence, 92% are students of color and 84% qualify for free or reduced price lunch. And like many schools across our country, Providence schools weren't safe even before the pandemic. In 2019, the state commissioned a report on Providence schools from Johns Hopkins University, which described visibly crumbling school buildings that lacked HVAC and were infested with rodents and contaminated with lead paint, asbestos, and sewage. These are the schools that our leaders insist are safe while an airborne infectious disease continues to ravage our communities in the world. Despite all of the public claims about reopening schools for equity, the reality is that reopening schools during the pandemic has meant that students in the communities hit hardest by COVID have been sent back to schools that have the fewest resources to keep them safe. Our schools in Providence remained open even when the per capita COVID rate soared to more than 9.5 times the maximum weekly rate of 100 per 100,000 people that was allowed for opening in the fall. Although leaders bragged about keeping Providence schools open in person last year, there is evidence that this enormous increase in the rate of COVID in the community put students and staff at drastically increased risk. The CDC science brief on COVID transmission in schools states national surveillance data from the UK showed an association between regional COVID-19 incidents and incidents in schools. For every 5 additional cases per 100,000 population in regional incidents, the risk of a school outbreak increased by 72%. If an increase of 5 cases per 100,000 resulted in a 72% higher risk of school outbreak, it doesn't take an epidemiologist to understand that our students and school community faced enormously increased risk of infection when the per capita weekly COVID rate in Providence increased by more than 850 per 100,000, and our schools remained open. When teachers speak up about unsafe conditions in schools, including the lack of stable groups, adequate ventilation, and sufficient room for physical distancing, officials dismiss our concerns and insist that COVID doesn't spread at school. In reality, we have no idea how many cases of COVID have occurred among students and staff because there's been little to no asymptomatic testing. This year, our schools are even less safe. The weekly per capita COVID rates in Providence and across Rhode Island are significantly higher than the maximum that was allowed for reopening last year. Given the high case rates, the increased transmissibility of the Delta variant, and the fact that children under 12 are not yet eligible for vaccines, it's evident that we need increased mitigations to keep people safe. Yet our leaders have done the exact opposite. They've reopened schools while the Delta variant is surging and removed many of the mitigations that could help to keep people safe. Full in-person learning with no remote option available for most students means that classrooms, hallways, cafeterias, and school buses are so crowded that students and staff are unable to physically distance themselves. While the Delta variant is surging and private companies are protecting their workers with remote options, students in our schools are eating indoors in groups of a few hundred at a time. It does not have to be this way. It is not at all normal to accept the necessary cost of getting back to normal is the mass infection of children in the community. It is ludicrous and inhumane to continue operating on the assumption that the best thing we can do for kids is to send them to school in unsafe conditions so their families can go to work. We can actually pay people to stay home. That is better than forcing children to sacrifice their health and even their lives for the sake of the economy. Keeping children healthy is the most important investment we can possibly make. History will not look kindly at the leaders who failed our children at this time. It won't look kindly at any of us who choose to stand by silently while children are put at risk. What greater act of betrayal is there for educators than to welcome students into our classrooms, knowing all the while that the conditions in our schools might kill them or their loved ones? For more than a year, I've done everything I could to advocate for safer learning conditions. The last thing I can do is to refuse to be complicit. I will not earn a living working for an institution that blatantly disregards the safety, health, and well-being of the children and community it exists to serve. I will not rationalize these unacceptable, avoidable risks by telling myself that I'm just doing my job, that I should just comply because there isn't anything I can do. I've wanted to be a teacher since I was 15 years old and have been working in school since I was 18. This year, I felt I had no choice but to resign in protest. You can't be neutral on a moving train, as Howard Zinn wrote. This train is still headed for the mass infection of children in our community. It is my sincere hope that those in power will find the courage to change direction. Thank you for your time.
Thank you, Maya. There's also been an exodus of teachers in our New York City public schools. Heartbreaking messages. If you're on teacher Twitter, you see all of their experiences. Brilliant educators that our children are losing because they feel like the system is broken and they have no power. I want to introduce Dr. Bradley Dreyfuss, who actually was the one who's been working with our communities to support education in terms of like living in the pandemic. Dr. Dreyfuss is an emergency physician and a public health expert. He's also speaking on behalf of Right to Safe Schools Arizona that have been elevating all of the voices, the lack of safety protocols in our Arizona public schools. So Dr. Dreyfuss, please take it away.
Thank you very much. Really appreciate the opportunity to be here. And today I am speaking on behalf of Right to Safe Schools Arizona and our coalition. Right to Safe Schools Arizona is a nonpartisan coalition of scientists, medical health professionals, lawyers, and families uniting together to organize and advocate for proven science-based policies to slow the spread of COVID-19 in Arizona's schools and communities. This has been a challenge for all of us, and from the beginning, it's been a challenge. Arizona parents and the coalition of civic and education groups made progress in the battle against the politicization of COVID-19 pandemic by the GOP-led legislature in Arizona and Governor Doug Ducey. The Superior Court found the ban on school mask mandates unconstitutional just earlier this week, paving the way for individual schools, cities, and counties to implement universal masking requirements in K-12 schools to mitigate the spread of COVID-19. Families still have a long way to go as hundreds of thousands of students across the state are attending schools that do not require universal masking despite rising cases. Further, a recent CDC MMWR study based out of Arizona found that the odds of a school-associated COVID-19 outbreak in schools without a masking mandate were 3.5 times higher than those in schools with a masking mandate. Governor Ducey and Attorney General Brnovich appealed the lower court ruling. Even as the Superior Court found the ban on school mask mandates unconstitutional, Governor Ducey is using federal funds to continue to actively thwart public health mitigation efforts in schools. Federal money that was allocated to help states mitigate the spread has been co-opted by Governor Ducey to actively incentivize schools to defy public health recommendations. Arizona has had the highest percentage of child cases compared with the cumulative cases in the entire country at 20.9% as of September 23rd, 2021. Arizona remains one of only 14 states with children accounting for 18% or more of cumulative COVID cases. And Arizona has the highest cumulative COVID-related pediatric hospitalizations in the entire country at more than 2,800. Arizona has the second most child deaths from COVID, 39 in the country, and second only to Texas, which had 79. But it's notable that Texas has 4.5 times the child population as Arizona does. Clearly, we have a lot of work to do, and change is possible by providing the tools and communities for parents and advocates to help push for safe schools and mitigation across ventilation, masking, and the rest of the mitigation measures. Thank you again for having us, and we look forward to working with you.
Thanks, Dr. Dreyfuss. In the last week alone, our country had 207,000 new COVID cases in children. Some of the trends that we're seeing is that right when school started, we're seeing more new hospitalizations in children. And what is really heartbreaking is to see that 10% of Black kids, 9% of Latino kids, 7% of Asian kids, and 2% of white children, they're the ones that are really being impacted. They're being impacted by COVID. And so we continue to see health disparities and social determinants that are not being addressed in our schools because we don't have these mitigation factors. And nobody's saying close all schools immediately, although God knows. We do believe that we can have children in buildings if they want to be in a building, but we have to implement all of these different non-pharmacological interventions to keep them protected. An expert in all of this work is epidemiologist and health economist, Dr. Eric Fagel-Ding. And Lord knows he has taken us on this journey, informing all of our communities and taking on all the anti-vaxxers, anti-maskers, and folks that really want to push to put our kids in a really dangerous place. He's a senior fellow at the Federation of American Scientists in Washington, D.C. He's the chief health economist for Microclinic International, and he's part of the World Health Network that has been supportive of us all organizing and coming together to educate our communities on the impact of COVID. Dr. Fagel-Ding, can you take it away?
Yeah, thank you so much for the introduction. And we're in a momentous time right now because schools have reopened. We're actually seeing everything that we warned about kids getting infected, kids getting hospitalized, and even kids dying. And just to put in perspective, we've had 1 million, almost 1 million cases in the last month. And in terms of deaths, we've had over 100 kids die in the last 5 weeks. In the last 5 weeks, schools hasn't even been open for 5 weeks nationwide. It's only been open in certain states, but we've already had over 100 children's deaths from COVID. And of course, there's innumerable also number of hospitalizations. We have to dispel the notion that this misinformation from last year that somehow kids are magically immune and somehow there's other so-called experts out there who've even said that, oh, kids are as if they're vaccinated. No, that is not true, because we see it in the hospitalizations, the pediatric ICUs, and we see it in the deaths. So I really want to emphasize that. And Delta variant is so much more dangerous that, take Florida, for example, the case fatality ratio, basically what percentage of kids who are infected die, that number has now soared to over 1 in 10,000 kids. And that number, when you multiply that by the sheer number of kids being infected, that's not a tiny number anymore. And this number is about 3 times higher than it was in the previous pandemic 1.0 before August. And so basically since August, not only are more kids being hospitalized and dying, but they're dying at a faster rate because of Delta. And this is why we need testing. We need quarantines. We need to notify parents that there's positive tests. And we really need, of course, the vaccinations. But above that, schools, we also need ventilations. And as we say in public health, the solution to pollution is dilution. And opening windows is so key. But the problem is, as you know, in many schools, you can't open the windows because of safe mass shooting prevention rules. And so if you can't open the windows, and what do? So you either mask, and of course, it's very unfortunate that Florida and many other states in the South prevent schools from instituting mask mandates. And so with that, you have to disinfect. And the Biden pandemic relief had money for these HEPA filters, UV, but unfortunately, many schools have been misspending it. They've been spending it on completely unrelated things that would actually reduce the risk for our children. And now we have to build Corsi boxes, Corsi Rosenthal boxes of these air filters with a box fan. And we're basically resorting now to jerry rigging and to keep our kids safe. And this is why we need really, really passionate parents and principals and superintendents and school boards to understand that you cannot just wish it away. That it is not some inconvenient thing that you can just brush underneath the bed, or it's a clear and present danger. COVID is here, and some will say, well, cases are dropping. Well, cases, first of all, are higher now in kids than in adults in certain states like Florida, because school reopening. And in addition, what we've actually seen is that the COVID can come back in a second wave. In the UK, they celebrated in July and August, Delta is going away. Guess what? Schools reopened there without masks, and cases there of Delta are an all-time high, higher than even their first summer Delta wave. So don't be complacent. Just because Delta looks like it's dropping now, it can clearly, easily roar back. So we need disinfection, we need testing, we need quarantine, we need all these measures together in order to keep our students and our teachers safe. Thank you so much.
One thing that I always find enlightening when Dr. Fagleding speaks is that some schools have decided, okay, I'm going to do this and that, and not necessarily all of the mitigation factors in one place. And one thing that we want to highlight is that we need to do all of those things.
Yes.
And another thing that we can do, and that 85% of school districts are providing a remote option for families that want or need it. There's another 15% that is not, New York included. And one of the things that we can provide when we have a remote option is more social distancing in our classrooms, an ability for our teachers to actually support all of the different mitigation factors in the space. A lot of us exist in communities where the school buildings are so old that you cannot open the windows. And so we have to think of all of these different nuances. All of our school communities are different. One of the things that I like to always bring up when folks talk about schools in Denmark or in Israel is that New York City has co-located schools, mass transportation, all sorts of different ways that we can exacerbate community spread, and schools are not exempt of that. And so we have to make sure that we have all of these different factors in place. So our second to last speaker is one of our main organizers, the one that brings us together sometimes multiple times a week, Dr. Yanir Bar-Yam. He's a complexity physicist. He's a professor and president of the New England Complex Systems Institute and the founder of the World Health Network.
Thank you very much. And I want to start by saying that it's hard to see a pandemic and to know how to deal with it. But from the perspective of seeing many other outbreaks that started from animals around the world, the story is very different. The story is that we know what we need to do. We know that what is the most harmful thing for action is denialism, claiming that it's not important, and fatalism, claiming that you can't do anything. The most important thing is to realize that the outbreak is very severe. It affects many people and very harmfully. And we'll talk about it a little bit more, that in ways that people have not yet mentioned here are extremely important. But in addition, the thing that we have to realize is that there is a tremendous amount that we can do in order to fight the pandemic. And if we decide to surrender in the battle against the pandemic, the disease doesn't take surrender papers. It simply keeps going, as we've seen over the past 18 months. So there really is only one choice in the face of an outbreak, and that is fighting it, and fighting it as strongly as we can, because the stronger we fight, the weaker the disease becomes. It's very much like fighting a fire, a wildfire. When you get ahead of it, you can put it out, but when you let it run, it will destroy everything in its path. And that's what we've been seeing with this pandemic. And now with the situation with open schools and the Delta variant, we have a much more severe, more transmissible variant that has a more severe impact, particularly on children, as we've heard. And the thing that hasn't been talked about yet today is the long COVID implications. We know that in adults, about a third of adults have symptomatic long COVID, but in addition, there's organ damage that extends to much higher percentages. And the reason is that the coronavirus that is the SARS-CoV-2, the coronavirus that is causing the COVID pandemic, is not a respiratory infection, as people often think. It affects the blood system, and it attacks it uses receptors that are all over the body, including the brain, including the intestines, including the heart, including other organs, and causes extensive damage throughout the body. Today, we have a situation where children, as we've heard, are being massively infected. We are not yet aware of the extensive organ damage that everyone is receiving. And in addition, there have been 1,800 hospitalizations in just the last week, very clear, severe harm that is being caused to these children. And the deaths at a rate of about 3 per day in the country are tremendously undeniable in terms of their impact on those children, of course, but their families and their communities. And allowing this to happen makes no sense. So what is it that we have to do? And the answer is there are very direct measures that we've heard about. There are the vaccines that are important. There's masking, everyone knows. And there's the ventilation and air filtration using HEPA filters. And there's distancing and cohorting. And of course, extremely important that we've heard is testing, and also the isolation and quarantining of contacts that should not be diminished in its strength. Rather, it should be increased so that we can stop transmission. Again, deciding that you want to do less is not the way to respond to a pandemic. It's deciding that we need to act in the strongest way possible in order to diminish the transmission so that children are not infected, and to help and also diminish the transmission in the community, which is ultimately the best way to protect children, teachers, parents, and the community. So this is all in our hands, and anybody that says that we cannot do things, they haven't tried, because there are always things that we can do. What we need to do is put our minds to it and think clearly about the fact that the strong action is the action that matters. Thank you very much.
Thank you. We have one more speaker. This is my baby. His name is Sebastian. And Sebastian has some words about how he feels about going to school. He's going to read. He's a little nervous. Good.
My name is Sebastian.
My 2-year-old apparently also wants to speak. Go ahead. Go ahead, Papa.
My name is Sebastian. I am 10 years old and I am in 5th grade. I attend the New York City Public School CPE 1. Sometimes I prefer to stay home from school because I don't feel safe in a school building. COVID is airborne and we must be physically distanced. And 3 feet is not enough. We need to stay 6 feet apart. I think we need a remote option for kids and families that want it and need it. This will help reduce class size, which will protect those of us that still cannot get vaccinated. We aren't getting tested enough for COVID in our schools. I've been there for 3 weeks and have not been tested yet. So my mom makes sure that we test weekly so I can keep my classmates safe. We know that thousands of kids have gotten the virus in the last 3 weeks. I demand politicians to protect us and keep us safe. We need you now before things get worse.
Thank you. So with that, we'll take any questions. The press release is in the chat if you need it, along with some other documentation, some petitions that some of us have drafted and participated in. And so we're all here in solidarity, again, to protect our kids and to hold our legislators accountable for protecting our children in our schools. We don't have any questions. ¿Hay algunas preguntas en español? ¿O se necesita hacer un tipo de comentario al respecto en español? Lo podemos hacer también. Okay.
Well, if anybody would like to ask about either basic science or about what the parents are experiencing or their considerations in today's action, please raise your hand and we'll be happy to address any and all of the above. So there is a question in the chat. Will there be more strikes held like this in the future?
Taj, you want to speak to what's happening in New York City?
Sure, I can, and I'd love to hear from other folks as well. New York City parents have been on strike since September 13th, and our strike is ongoing. We're really excited to find out about this strike across the country, but we have been and will continue to be striking. And so what we've done in order to empower and also inform parents in New York City is we've provided a toolkit with a wide variety of resources, information templates, lists of elected officials from the Assembly all the way to the Senate, and also, and this is a really key point that Dr. Yaba mentioned also, but list of all of the district leadership. So your superintendents, your executive superintendents, your family support coordinators, because those are the individuals in the schools that interact with families and are that bridge a lot of times between the children's services and the schools. And so we're really trying to apply pressure throughout the strike on these individuals as well as our elected leaders to say, listen, you know there's a pandemic. You know that if it was your child, you'd be considering staying home, and you need to create the conditions for parents to stay home safely and to stay home and be supported, whether that means paying folks to stay home, whether that means providing a robust and culturally responsive remote option with language access, right? These are all the things that we're fighting for, and part of the reason we're striking as well. And so it's all working in tandem, and we intend to strike indefinitely. I've been on strike since September 13th. I have no plans of sending my children to school.
Brenna?
Yes, same thing here in Chicago. We have been on a parent strike since August 30th. So we will continue to keep our children home until the safety mitigations and a remote learning option are put in place. So that's why we're very hopeful that with our new CPS CEO, Pedro Martinez, that he said he will look at expanding remote learning. This is amazing. For the past month, we've heard no, no, no. And he comes in on almost the first day and says, I'm going to listen to you and I'm going to look into this. So we know that parent pressure works. And as soon as we can get some of these options, we are happy to return to participating in school. Unfortunately, since it has been over a month, there have been many parents that have already chosen to exit the public school system. They've drawn their kids out of school, they're homeschooling. There's been kids that have just been unenrolled and forced out because they haven't been coming. And we know, again, as has been said, as Taj said, this isn't the parents failing their children. Our parents, we want our children to have education. It's the system that is failing our children right now.
Brad, do you want to add a little bit? What's happening in Arizona? What's next?
So what's next is we have plenty of school board meetings and board of supervisor meetings where parents and community members are feeling much more empowered to speak up. Many of the schools that didn't previously have mask mandates or were very hesitant have been emboldened by the fact that the mask mandate ban was knocked down. So it remains to be seen how things move forward, or if the governor and the legislature try and put through another piece of legislation to ban public health measures. But I feel like as we create larger and larger voice to follow the science, that will hopefully be less likely, but we have to stay vigilant.
Excellent. Sandra Díaz pregunta, después de esta protesta que sigue, Sandra, estábamos hablando de eso mismo ahora. Lo importante es verificar qué es lo que está ocurriendo donde tú estás viviendo. Hay muchas personas que siguen protestando de ir a la escuela, por tanto están dejando a sus niños en sus hogares y están pidiéndole a los departamentos de educación que les provean la educación que sus niños merecen. Así que si tienes a tu niño en su casa, manténlo en tu casa y sigue comunicándote con los políticos en tu ciudad en la junta de directores del Departamento de Educación para que ellos entiendan cuáles son las necesidades suyas, de su familia y de su comunidad. Así que te exhortamos que sigas comunicándote con nosotros y nosotros seguiremos apoyando tus necesidades. Munika says, how can it happen in a so-called free country that we are forbidden to provide safety and health for our children? I'm with you. I have no idea. Brad is sharing, how do we keep our new governor in the New York State, Kathy Hochul, how can we hold her accountable? And I know Taj has some information for you, Brad.
Thank you. And that's a really great question. I think two really important places that we can push are for Senate Bill S 7381 and for the related Assembly Bill, I believe it's 8283 by Senators Lou Jackson and Assemblymember Fernandez. Those are legislative bills that are currently on the floor for reinstating a remote option. But because the legislature is not in session right now, our governor, Kathy Hochul, would have to either hold an executive session or like a special meeting. And so one of the things we've been encouraging our parents to push for is to get Governor Hochul to have that executive session and to move this remote learning legislation forward. Because something I think that folks forget is that, as Sebastian stated, a remote learning option is one of the surest ways to reduce class size. And that is going to help with, as we, fix the lackluster ventilation, that's going to help with social distancing. That's going to help with making sure that every child who needs to be in person, right, has the resources necessary to do so. And so we're really encouraging folks to hold the governor accountable for helping us be safe with the powers that she has as governor and utilizing these bills that have already been crafted by assembly members and senators to keep our children safe.
So one thing that New York City has is mayoral control. And that's been one of our blocks in terms of being able to enhance the mitigation factors in our schools. We don't have a school board that can actually push these things. The mayor is the one that ultimately has control. So Kathy Hochul can actually impose an executive order to get the mayor to move, not just on the remote option, but also to implement testing and all of the other mitigation factors. So we have to keep on pushing, as we do in all of our states, and with our president and our Secretary of Education. So I do want to say that Dorothy is saying, I'm curious if you agree with what HHS Secretary Becerra said yesterday in the Senate, that there's no shortage of COVID-19 tests at schools. It's just getting those tests to the schools or areas that need them the most. I don't know.
Let me say, what does it mean if there's no shortage at schools if they're not in the schools, right? So the schools are experiencing a shortage. That's just doesn't make any sense as a statement. But there are many different things that have to be done on the testing front. One is to recognize that other countries already have under $1 tests that can be done on the moment in order to be able to do testing. The availability of tests should be very widespread, and to recognize that we really need to raise the bar in terms of what we consider to be adequate testing. Talking about 3% or 10% testing per week is not in the right ballpark. To have 100% testing of everyone per week is actually even not enough. What we really need with the Delta variant, because the Delta variant infections grow very rapidly. So the typical incubation period is only about 4 days, whereas before it was 6 days. So at 6 days, you might say, well, maybe if you do it once per week, you might catch a significant fraction of the cases. But at 4 days, you're not going to even capture a significant fraction of the cases. So really have to do it less than 4 days between tests, and preferably once a day. And if you really want to stop the transmission, which we surely should, then you can even do it more times than 1 time per day. Why not twice a day? It's really possible at tests that cost less than $1 a day to really capture a lot of the cases. and to use that as a mechanism, not just for saying whether this person is sick, but to stopping the transmission across the schools and across the community.
Thank you. Yep. I testing, I can't even start. It makes me go wild. The lack of testing in our schools. Dr. Dreyfuss, you wanted to add a little bit about, can you add a little bit about hospitalizations and how that impacts our communities and the load on our healthcare workers?
Absolutely. It's been a huge load on the healthcare workers. I mean, the news has been riddled with nursing and staff shortages, how everyone's been going full bore, especially in Arizona, pretty much since the beginning of March or middle of March 2020. So we're at 18 months. Beds remain unstaffed, et cetera. One of the major problems we've had with Delta specifically, as Yanir had mentioned, is the fact that it affects children so significantly and the rate of spread is so high. Arizona's numbers have been astronomical, and we only have 800 pediatric beds in the state. All right. So that's for all patients, our diabetic children, our children with neurosurgery issues, et cetera. We had a situation actually earlier this week where a patient needed to be admitted to the ICU, and I was looking to have to actually potentially transfer them up to Phoenix, which is an hour and a half away because there were no other pediatric ICU beds in our city in Tucson that could address this child's needs because of the neurosurgery services they needed. Now, that doesn't need to be, it shouldn't be, but that's where we are with COVID. And so being able to control the spread, not just in the students and teachers, which is imperative, but all of their family members. Kids are just like they usually, every season they bring home the common cold and they transmit flu, and we're usually able to protect against that. COVID is just a whole other animal just because of the Rona, which is on par with smallpox. Instead of infecting just 1 to 2 people like Alpha variant did, it's 5 to 8 people, which is again on par with how smallpox was. And so we need our bed availability. We need the flex capacity for our traumas, appendicitis, gallbladder issues, diabetic complications in our kids, as well as pretty much anything else people might bring their kids in for, just typical orthopedic injuries, especially during sports seasons. So this is something we need to get under control. I think there's a lot to learn from what could have gone better in Arizona or been better managed in Arizona, especially in the Northeast where the levels aren't quite the same, but the population density really is a setup for absolute disaster. And so I applaud the rest of the speakers and the rest of the group's efforts in really trying to get ahead of the ball, because prevention is really the only mechanism to preventing disaster. But thank you all.
Dr. Fagel-Ding, how do we keep on bringing people into this conversation and also give them up-to-date information on vaccination and how important it is to just be a hoarder of information so you can make the most informed decision for your school communities?
Yeah, I think that's a really good question, because the information is changing so fast. It's like drinking from the fire hose these days in terms of keeping up with boosters, variants, waning efficacies. And I think, first of all, there's a movement that I think Israel's already made, that you're not fully vaxxed until you're triple vaxxed. And even Fauci yesterday also indicated that's probably where we're headed very soon. And I would warn that, if you have only just 1 shot of Johnson & Johnson, that you have to be extra careful, because 1 shot is not enough. And Johnson & Johnson latest booster trial shows that, it really helps to have another booster, especially if you have Johnson & Johnson. There's a lot of these data that's coming out. And of course, keeping up is sometimes hard, but just know that what used to be kind of true, kids were immune, wasn't really true because we weren't testing kids enough last year. But now it is much more severe. So it is much more airborne. In fact, we don't even think that it's surface disinfection whatsoever. It's almost entirely airborne. which also, as someone else early pointed out, it's, 3 feet, 6 feet are not enough. Plexiglass is not enough. It really relies on you either ventilating and using CO2 monitors. I think that's really helpful. There's a lot, and CDC actually only recommends only 2 types of disinfection. Besides, air HVAC, using MERV 13 filters, they only recommend HEPA filters or UV. And like UV, there's classrooms, there's upper air UV in which there are beam that shoots in the ceiling. So there's no UV on our kids or anything like that. And those are the only things. And there's why I say this, because there's a lot of fake cleaners. There's school districts have spent $500,000. I'm not going to name the school district, that have unfortunately spent $500,000 on the wrong air cleaner, the bioionizer and many other air cleaners that aerosol experts absolutely say, do not buy those. I'm not going to call out any companies right now, but stick to HEPA. Don't go with HEPA grade, HEPA-like, HEPA equivalent. Use HEPA only, classic HEPA, or upper air UV if your school can afford it, which your school should, because the Biden pandemic relief bill had all this money for schools. Unfortunately, many schools districts misspent that money, and this is where there were suggestions, there were guidelines, but there were no hard rules. And when there were these kind of misinformation out there from many of these other companies trying to peddle their products, unfortunately, many school districts were susceptible. And this is why I think it's really key to stay up to date with the latest data. Don't go by what a company markets to you. And just know that information changes quickly. And as for vaccines, I'm very hopeful that the Pfizer shot will be available for kids 5 to 11 by Halloween, fingers crossed. But I want you to also remember, just because the shots are available starting November, that it takes at least a month and a half between 2 shots, right? Before a kid is fully vaccinated. So it's going to be until at least mid-December before kids are fully vaccinated. So that means this entire fall, we cannot rely on vaccines to protect our kids. It is a very fanciful but very dangerous waiting game to put all your eggs in one basket waiting for a kid's vaccine. And also many preschools and elementary school kids under age 5, those kids' vaccines 2 to 4 years old will have to likely come in, December or January, or if not later. So don't wait on just vaccines. Vaccines in itself are great for preventing hospitalization, but for transmission, it is not enough. And I think the best analogy is, there's 2 scenarios. If you have a virus that's more severe but less contagious, or much less severe but more contagious, in the end, what will send more people to the hospital? It is the much less severe but much more contagious virus that will balloon the denominator, total people infected, and send them more hospital and deaths. And also long COVID. So please, stopping transmission is the most important. Don't just focus on death and hospitalizations by itself.
Thank you. I have no words. My mayor actually spent $40 million on some shanky purifiers.
Yeah.
And we had to rely on our teachers to expose him, which was a whole other thing.
Yeah.
Our teachers are pretty badass.
This is why the Corsi Rosenthal box, a jerry-rigged box of 4 or 5 of these filters taped together with a box fan, is actually really good. The aerosol experts actually say it's almost as good as a HEPA filter, and much less expensive. So a lot of parents are building them and donating them to schools, which is a really great idea.
We actually had gatherings in New York City. Parents came together to make them. Yeah, totally.
This could also be something that this, if I can just interrupt real quick.
Yeah.
This is something we could also be pressing the students and the schools to work on, whether it be science projects or otherwise. If there's one thing I've found from really organizing with Right to Safe Schools Arizona and with HCW hosted, is that people want to have a role in solutions, right? So really finding ways to really have the students be motivated, I think is exceptionally important. And when you actually talk to students and you talk to kids, they're saying our parents aren't listening, right? Or our communities aren't listening. So maybe it's time to give the students more of a voice as well and create a creative forum for like that. They do it independently, but why not do it with our advocacy organizations? Anyway, thank you all.
Hands down. And I can definitely shout out Taj for doing a lot of that work with her students. A lot of our kids in New York have been a critical voice in talking about safety. So I want to be mindful of our time. It's 1 o'clock. So Yanir, you want to talk a little bit about the World Health Network meetings that we have on Thursdays?
So everyone is welcome to participate in World Health Network activities to promote safety in schools and for children and for parents, and the need for implementing precautions and having alternatives like remote options. We have those meetings currently regularly scheduled on Thursday, but may happen at other times, depending upon what's needed. For those of you who would like more information, please go to worldhealthnetwork.global. That's a global network of organizations, scientific as well as community groups, parents groups, long COVID groups, and many other groups that are concerned about getting past this pandemic and promoting safety of everyone. Thank you.
Yeah, and on Monday, we also have an action where we're acknowledging our healthcare networks. So be on the lookout for our social media to know how you can participate. We want to thank you all for your time. You can find this press conference on YouTube. It's also on Twitter. And so we just want you to know that we want to engage in this work because we care about children and we care about our communities. We want to support our teachers that have been put through so much. And we come together collectively to elevate the voices of those that are most vulnerable and that have been impacted by COVID-19. We want this to end, but the only way to end it is if we do it collectively. So thank you so much for your time. Please join us on all of our other actions. Working together is the only way that we're going to get any of this work done, and we continue to protect each other. So in love, compassion, solidarity, and gratitude, thank you so much for joining us today.
Thank you.